we call younger adolescents. And younger in the sense of they were 11 to 15-year-olds, so we didn't take anybody over 15. And the average age was 13, 14, where if you notice the other studies, average age was 15, 16. So a little younger. Not all of them were heavy into drug use also. They were, again, male, mostly male. Primarily what we consider in the U.S. minority youth, although actually it's changing, Hispanic and African American. Low income, single parent home, comorbidity, conduct disorder, ADHD, depression. And for many of these children, 98% it was their first experience with treatment. In many of our other studies, children have been in treatment multiple times. And let's look a little bit at this. This is very confusing. Let's look at this one, just change in marijuana use over time. So the yellow, that's the kids who got group therapy. They got group therapy, and it went down, but not so sharply. The children who got MDFT, huge. Look at that very sharp, steep decline in drug use. See, I think I have another. Hello. Okay. Then we look at arrest, also from the same group, and these are percent arrested during the 12-month follow-up period, and you can see 23% in the MDFT group were arrested versus 44% in the group condition. So that's 50% better. That's great. And if then we look placed on probation during the 12-month, only 10% of the MDFT group were placed on probation, and 30% of the group treatment. So, I mean, you could be arrested, but your charges could be dismissed, which is why you would have that. So, again, great, very impressive outcome. We also looked at mental health symptoms in this study. This is a measure of general mental distress from the game. Some of you may use that. And again, the group treatment, they do go down, great, over the 12 months, but the MDFT, a sharper decline at first. We see that in a lot of our other studies, and maintaining the gain over 12 months. I mean, really good. Then we have another study, MDFT versus individual cognitive behavior therapy. So not group therapy, but more like the INCANT, individual therapy and cognitive behavioral therapy, and really good cognitive behavior therapy, because we did this study in Philadelphia, which is the home of cognitive behavior therapy. So, and we had great therapists. 224 adolescents were randomized to these two conditions. Average age, 15. Again, male. It's a problem. And this was a heavily African-American sample. We did this in the city of Philadelphia, which has a large African-American population. Family income low, 88% with substance-dependent diagnosis, 60% had an externalizing disorder, 28% in diagnosable internalizing disorder. And let's look a little bit at them. Let's look at abstinence. That's a lot, right? Not using cannabis. And you see, this is MDFT, this is CBT, intake. Not too many people were abstinent, right? And then at discharge, 42% discharge, and 6 months for the MDFT, 42%. And then the MDFT results continue to do better. At 12 months after intake, 64% are abstinent. Where if you look at CBT, there's improvement, right? More kids are abstinent, around the 40%, but it maintains itself. It's less than MDFT, certainly here, and it just maintains itself at that level, where in this study, the MDFT increases their abstinence. CBT, it does well, but it maintains itself, and the MDFT does drastically better, sharp decrease, and maintains and continues to do, you see that trajectory down over time. And is this my favorite slide, my next one? This is yeah, this is interesting. This is hard drug use, drugs other than marijuana or alcohol. And look at this, CBT, they basically stay the same or increase hard drug use over time. MDFT use, sharp and continuing sharp linear decline in hard drug use, which is amazing. Then we have another study, Cannabis Youth Study, 43% reduction in cannabis use in MDFT that maintains itself over 30 months. And we did a study where kids came to juvenile drug court and they were randomized to MDFT in juvenile drug court or a very intensive group and individual treatment in juvenile drug court. And we wanted to see if treatment made a difference. There's a lot of indication that drug court is a very powerful and good intervention. But we wanted to see, does an evidence-based family treatment, does that do better than a non-family treatment? Or is it just that drug court itself is such a powerful intervention that it doesn't matter what kind of treatment you use? And, oh, this was interesting. This is important in this study. The children in MDFT and in group got about the same amount of treatment. MDFT, 9.5 hours of treatment a month, and group 10.56. The reason why I say this is important, because in many studies this is like a little, it shouldn't be a secret, but a lot of people don't pay attention. When you have an evidence-based treatment, or you have a treatment, and you want to say, okay, we've got this manualized treatment, we want to see if it's better than this other treatment, or better than treatment as usual. The lousier, do you know what that word means? The lousier your comparison treatment is, the better your evidence-based treatment or your systemic treatment is going to look. So one thing we look at is amount of treatment. In many of these studies, the experimental treatment, the so-called evidence-based treatment, gets much more therapy than the alternative treatment. So you wonder, is it the ingredients or is it the amount of therapy? You know, these are important. So in this study, because court ordered them to treatment and made sure they went, both groups are getting the same amount of treatment. Different treatment types, but the same amount. So I think that's really, really important. And we looked at the results in two phases. We looked at phase 1, which is from baseline to 6 months. And that's basically when all the kids are in drug court. And then we looked at 6 months to 24 months when they're out. Because one of the issues with drug court is like, oh yeah, you get good results while they're in drug court because everybody's on top of the kid. They have to come to court once a week or every other week. Their probation officers calling them, they're in treatment, the school, I mean, you know, like, of course they're gonna. So what's really important is what happens afterwards, right? And there's been some evidence to show that kids do well in drug court, but then when they leave, they go back to their drugs and they're not going to school and crying and whatnot. So we wanted to test that. So looking in 6 months baseline, what we found is all youth showed a significant decrease in substance abuse. The kids who got the group and individual and the kids who got MDFT. Huge decreases. 76% decrease in substance use for MDFT, 65% for group. It's big. In drug tests, we did urine testing, and the decrease for MDFT was 66%, 20% for group. I don't know why there was a difference. These are just 3 different ways of looking